Thanks very much, Dr. Modaga. Greetings again to the collective here. Honourable Chair, it's Heritage Month, and a lot of people are still in that mood of heritage. And we are over 30 years into democracy. And our healthcare system to date does not clearly integrate indigenous knowledge in terms of creating holistic healthcare. Therefore, we are calling upon the department to create a platform which will include and integrate those who practice with indigenous language. Mangaka borena le batho ba borena ba ile gore ba believer go metlhashana ye e creatileng ke tlhago ba modimo le badimo nke ba dumelelwe in a dignified manner to which will be regulated to assist the healthcare system which is flooded. Sometimes our doctors don't even know what is the cause of problems, and if so we'll appreciate if the leadership of the department can zoom into that space. Honourable Chair, as I go into the inputs, we are further asking for mobile clinics to be availed to the community of Juju Valley and all informal settlements in the province of Limpopo, and a clear timetable must be published for public so that the communities can know at what stage or period are the mobile clinics coming to their villages. I'm raising this premised on the fact that there are cases of malnutrition which are detected very late. There is a concern from the report which says that people detect pregnancy very late, which affects the whole fetus development cycle. And if people detect very late, because it affects the entire lifestyle of a mother-to-be. So if we have mobile clinics all over in communities and they work 24/7 where possible, people will be exposed to what needs to be done, what are the signs to check on if one is pregnant, and it will minimize future medical expenses and some of those which will fall in the category of medical legal bills. Honourable Chair, there is a specific incident which is worrisome of Chelezene Hospital, where over 1.6 billion of the medical legal claims emanates from. And we call upon the MEC and the HOD with their collective to zoom into that space and check what is the actual cause. Do you have proper people who are willing to do work there as professionals? Or what is a contributing factor of that institution being number one in terms of those bills? Or do you have a scheme which you are not aware of, which involves attorneys, courts, sheriffs, and so forth, that complex chain, which then leads to the department losing a lot of money? That space, please zoom into it thoroughly so that you can save the state billions. Especially also the other thing which you need to analyze is how many cases are from the sheriff, or how many cases you were not notified, and which court was central in terms of awarding such costs without your office being involved. Then you will know what you are dealing with. We will request, Honourable Chair, a report in terms of performance of the attorneys which are being assigned now to deal with medical legal bills claims, so that we check if they are indeed performing or they are just there to push time and claim from the department. What is the success rate and what is the failure rate? What are the issues which they have picked as legal people, which are common in all the claims? Please avail that report to the committee. And in the meeting before this one, we proposed that the department must explore the possibility of having liability insurance for medical professionals, because that will then remove the burden from the state in terms of paying some of these claims. Because some doctors or medical practitioners who are employed in our hospitals have private practices, but none of them in their private practices experience medical legal claims. But when they practice in our public hospitals, they contribute to that factor, so that can be ignored, Honourable Chairperson. I think the doctor here next to me raised the issue of conditions in our mortuaries, government mortuaries is very bad. If you go to the biggest hospital, Polokwane Hospital, you still write Petersburg. Actually, we must then get a progressive name. If Polokwane is not acceptable, I don't know why you still use Petersburg. The workers there are not happy, MEC. They are overstretched. The conditions, like in any of the mortuaries, are unbearable. You can imagine the claims in future, in-house claims from those people, from what they inhale every day. That is a health hazard and is worrisome if it's happening in your department. Chair, there is an issue which they raised here that they can achieve some of the targets because it's bus related. So that is a very important system. Tomorrow we'll be told that there were dual payments or people were not paid or the system collapsed. They are not elaborating what is the actual cause of the system failing them, because they are blaming the system. What is that they've detected? Unfortunately, the CFO is not here, but the HOD can deal with that, because it can't just be best failure and related to the input I made before this one. You must prioritize claiming your monies from RAF and medical aids. And you need, even if you were to get a dedicated panel that must rotate to go claim monies from you, from these entities, and they be paid when they bring back the money, so that you don't spend additional money on legal personnel. Chair, there is an issue of PB for under 5 years, and they are just saying it's poor implementation of something there. And the same poor implementation of something recurs when they speak about MDR-TB. So we need clarity. What is that the department is going to do to make sure that there is total compliance in terms of this important indicator? If you targeted 150 to get 150 students and 200 applied, you actually granted 200, and their own reason or reason for variation or whatever, you say no reason. We need a reason why give motivation why you got to 200 from 150 to 200, because we'll sit here and clap hands and you'll find that you just got some people from your branches or villages to add the 50. 50 is a big number. And we will appreciate if the motivation can even reach 2,000, but we need a reason. It can't just be zero and no reason, but you have exceeded what you have planned for, because it has, I believe, budget implications which must be attended to. Fortunately, the AG's office is here. They will tell us if I'm wrong, that if you exceed that target of 150, the budget is going to be affected, and they will fight with you later on. MEC, in one of the meetings, there was an issue of Limpopo Airport, and I'm raising it here, Chair, because they said medical personnel is used by medical people. Majority of medical people are landing in that airport, which is not regulated. And I wanted to check if you are aware of those medical activities which are happening in that airport, which does not have a proper license. We checked. We are waiting for further reports, because we don't want to sit with a problem or a scandal later where people are doing human harvesting of organs and all that in our province, and you are not aware. I'm bringing it to your attention so that use Zoom. When we said it must be closed until they get a license, the motivation was that it's a very important airport for medical people in Limpopo. So please zoom into that space. We have noted progress which is being made in terms of the issues that which were previously raised in the last meeting, Chair. Just the last issue, as we emphasize that there is a need to integrate indigenous knowledge so that we have holistic healthcare system in our province. I thank you.